Hi, my name is Jared Carter, and this is going to be a video on tennis elbow, more specifically what you can do for your own tennis elbow. And I'll say up front that all these techniques I'm going to show you are no substitute for getting good licensed professional help. There are a lot of things that can be involved in causing tennis elbow that simply cannot be undone or treated on your own. But as you'll see, there are a number of things you can do to get at a lot of the different underlying problems that are actually often missed in clinics where people go with tennis elbow because the people in those clinics or the practitioners are so rushed and they're kind of having to focus just on the elbow, when in fact a great deal of tennis elbow issues can be predisposed by and caused by things everywhere from the fingers all the way up to the neck and mid-back. So we're going to dive into it. We're going to take kind of a proximal or close in to distal approach. So we're going to start by looking at the mid-back and how you can mobilize the mid-back. So I'm going to position myself over here, and you're going to set your hips down in front of the foam roll and get the foam roll set up about mid-back. You're going to clasp your fingers like that. You're not doing a strong grip because you don't want to flare up the elbow. You're going to support behind the head and pull the elbows in close. If they're out here, you're going to be rubbing on your shoulder blades. I want you in close with the elbows. Lift your hips up, head's kind of tucked in. And you're just rolling up to the base of the neck and back down to the mid-back. Just like that, nice and slow and easy. You don't want to go down too far where your abs start to shake. Just kind of mid-back up to the base of the neck, nice and easy, just like that. Then you're going to come back to the mid-back, set your hips back down, and then do just some gentle extensions of the back. Do 3 to 5 repetitions and then move maybe an inch down. Do another 3 to 5 repetitions and movements. You're basically doing multiple levels up the back until you kind of get to the neck. Now, don't cause any sharp pain or any issues with this. Obviously, this is a video just about the tennis elbow, and you need to speak with a healthcare practitioner if you're having pain with any of these things. And obviously, don't do anything that causes sharp pain. So, next we're going to look at tension in the upper neck that is very commonly the start of tension that runs down the arm and can be have an effect on what's going on in the elbow. So this is a Theracane. Every tool I'm showing you here, I'll put a link to below the video, wherever this video may lie. So you're going to be kind of just working on different areas of the upper trap. So I'll just do it over my shirt for now. But basically, you're going to kind of come in, hold, the elbows are relaxed down by the side, the hands are holding the Theracane like this. And then you're just going to do gentle rotations of the neck, like that, and then just gentle side bending away from where you're holding the knob of the Theracane. You do that on a few different points along the upper trap. We're not here in front, like right behind the collarbone. There's a lot of vasculature. Be careful there. Stay back here on the meat of the shoulder muscles, okay? So you just kind of find a few tight spots and work rotation, like that, and then side bending away. You can also lean diagonally down and away, like this. You're not really moving the Theracane itself. You're just holding these different points and then moving the neck so you get a nice stretch down to that point where you're holding the tissue. Okay, next, we're going to start to work on other areas of soft tissue. Right through here underneath the collarbone, we have the pec muscles. They can often be tight, very common for people to have what we call forward shoulder posture, and that can cause some compression of the blood and nerve vessels that are running down the arm. It can have some effect on how the arm's functioning. So working on opening this up, as well as working on the tissues on the back side of the shoulder blade, I've found to be very helpful with a lot of tennis elbow cases. So the way we're going to do that is we're going to go into a door jamb over here. We're going to place a lacrosse ball right into the door jamb, and you're just going to come up and put some pressure right into the lacrosse ball, right where your pecs are. You're going to kind of use your legs to go up and down, rolling up and down right along the front side of the shoulder where the pecs meet. You're not grinding into the collarbone, and you're also not right on the shoulder itself. You're right into this kind of divot right here with that. Okay. Then to get the back side of the shoulder, same thing, so it's not rolling around. It's nice to use a a door jamb for this. You're just going to put it on the back side of the shoulder blade and find any tender points that you can, and there's often a lot of them, and you're just going to hold those points, maybe do just little movements, not so much of the shoulder, but use the whole body to kind of rotate and just work those tender points for a bit. Okay, and then we're going to move down the arm. You can just use a door or wall for this one. We want to work this whole line of tissue from the side of the shoulder down to the elbow. And the way we do that is pretty simple. We just kind of place it there. You can keep your hand under in case it's kind of hard to keep them in place. But you're just kind of working up and down, back and forth a little bit. And then you move it down. Same thing, just kind of work each spot and just work that all the way down to the elbow. Now when you get down to the elbow, if there are any points that are like ultra tender, I would not put a ton of pressure on those. Leave that to the trained professionals. But similarly on the forearm, you're going to basically work all the tissues along that line. And notice I don't have my arm out against, like out away from my body here, and I'm moving like this. I'm pinning my arm against the ball with my body. So I'm actually using my body weight and my shoulder and everything, and my arm just get to relax. So I'm just kind of finding these tender taut bands of tissue that run down the forearm, in most cases a tennis elbow. Again, I'm not right on the bony point that's most tender on this. I would avoid that. But I'm going to work all up and down, all the way down, even to the top of the wrist. Just like that. Okay, so now we've worked all the tissues all the way up to the neck, and we need to do some stretches. One stretch I'd like to do just to kind of start loosening this up or to lengthen the tissues there is leaning to the side and then extending the arm out in this direction. And you really feel like you're trying to extend through the fingers. And a lot of times people, when they do this, they'll feel kind of tingly. You don't want to hold too much on the tingly stuff, but you should feel some kind of a stretch somewhere along the arm or shoulder or neck. And wherever you feel it, that's where it's tightest and that's where you need to feel it. We're not holding anything intense, just a nice, gentle feeling of stretch. And I'd probably try to hold that for a good 60 seconds as long as you're not having any sharp pain or tingling with that. Next, we're going to stretch the forearm muscles here. So you're going to make a very loose fist. In fact, don't even try to squeeze the fist. Just make the fist position and let your your other hand do the work in terms of bringing it into flexion. The reason we want the fingers tucked in is that really puts a tension and a stretch through the muscles we're looking to do. If you have your fingers out and you just do that, sometimes it's just a stretch of the wrist. To get the muscles stretched, which is what we want, you're just going to have that loose fist, hold the fingers in with the other hand, and then stretch till you feel, or bend till you feel a nice gentle stretch. Again, I'm not big on anything that causes sharp pain in terms of your self-care technique. So just holding that for 60 plus seconds, right? And I would probably do that a few times a day. Now we have released a lot of the tissues, stretched a lot of the tissues involved. We're going to get into some other techniques that involve strengthening, and also something from Mulligan, which is called a mobilization with movement that some people are able to do on their own. And if we come over here, we're going to be against the corner of a wall. Now this is a really tricky one, and if you can't get it to be completely pain-free, then you just don't do it. The whole point of this is to take a squeeze of the fist, which is usually painful for people with tennis elbow, and get it to be completely pain-free, and then repeat that normally painful movement in a pain-free manner. And what it is, it's a neurological technique. It's reinforcing to the brain that when I do this thing that usually hurts, it no longer hurts anymore. So how do we go about that? What you're going to do is you're going to get a little towel roll or something like this, and you're going to come up to the edge of a wall. And if we take a top view here, you can kind of see exactly where you want to place your arm. So here is that tender outer bone that you're dealing with. And on the inside, there's a similar bone, right? And so what you want to do is you want to have the wall right on the other side of that inside not tender bone, but the inside bone here, the innermost bone right there. You're going to have that just on this side of the wall, okay? Then you're going to come with your hand kind of in this shape, and you're going to place your index finger right on this side okay, so kind of closer to my body side of the tender bony point right there, right? So you got the wall a little bit further away from the body, and on the other side of the medial bony point, the inside bony point, the outside bony point, you're right on the other side of it, closer to the body. And then, keeping this relaxed at this point, keeping the right hand relaxed, we're going to pull with the left arm, or with his hand, directly in line with this line of the wall, right? You're gonna pull just like that, and at that point, you're going to squeeze. Go ahead and get a picture of that. You're gonna squeeze the hand. Now, if that takes the pain away of that squeeze completely, you're just gonna hold that pressure, and then you're gonna squeeze again, hold 2 seconds, relax, 2 seconds, relax, and you can do that 10 times, and you're gonna do 3 sets of 10. Now, what often will happen is that it doesn't fully take the pain away, or it doesn't really affect the pain, and that's where you have to start making some adjustments up here. And what I mean by adjustments is you start to pull in slightly different directions. The hand placement is the same, but instead of pulling directly to the side, you might pull a little bit kind of towards the body, or a little bit towards the wall, a little bit down. And basically you're just playing with the different angles and then testing. So you pull, test, okay, there's still some pain, I'm gonna change angles. Pull, test, still some pain. Okay, I'm going to change angles. Pull, test. Okay, now that's pain-free. And when I mean pain-free, when I say pain-free, I mean pain-free. There cannot be any pain, because then you're just reinforcing the pain that you're already having. If you can't get a position or a pull on the arm that doesn't take your pain away completely, then you just can't do this technique. You can't use the technique. But you can kind of play with the position until you find one that's pain-free, and then you're going to repeat that 3 sets of 10. Okay, and then the last thing is going to be a strengthening exercise, but specifically eccentric strengthening. And there's a lot of this online. You probably, if you're looking around on YouTube videos, you've probably seen something about this already. But this is actually backed by research that probably 60-70%, I can't remember the exact numbers, of people that do this for about 6 weeks at about 3 sets of 15, I believe it was, will have some significant relief of their tennis elbow pain. So how do you do it? You get a TheraBar from TheraBand, and you're going to hold it like this to start. Then you're going to come over the top. So basically your thumbs, like your affected or painful arm, is holding it up with the thumb up. You don't have to have the thumb up, but that's the direction there. And then the other arm comes through like that. So the thumbs are kind of facing one another. Then you're going to bring it out straight in front like that. Okay? And then you slowly let your affected arm move down in that position. Okay, so that's 1 repetition. So you bring it back up here, you're going to come down, slowly let it go out, come back up here, move down, slowly go out. Now a lot of people they'll tell you to do this and let it go out and then just work like that. That's eccentric and concentric. That's not purely an eccentric protocol like they had in the studies. So you want to come back up here each time and then slowly let it down. Come back, extend out, slowly let it down. As you're doing these, make sure your shoulders aren't coming up too much. And keep your shoulders down, just like that, slowly down. And again, if you can build up to, I wouldn't start with 3 sets of 15, maybe start with just 1 set of 5 or 1 set of 10 of that, and then each day build up over time till you're getting up to that 3 sets of 15, 3 sets of 20 per day mark. Do know that early on, this can actually, that exercise and a lot of this stuff can make you feel a little worse at first. Don't worry, especially on the eccentric one, if that flares you up a little bit, don't worry too much about it. Just keep your numbers low and build up over time to that 3 sets of 15 and try to hold that level or more for at least 6 weeks. A lot of people watching this video already know, tennis elbow can be unbelievably stubborn. Even with getting good treatment, it can just continue to come back and plague you. So this eccentric protocol is one of those things that can be discouraging at first if it makes you worse, but over time, for 60-70% of people, it really does help. So hopefully all these things do get you headed in the right direction. Again, usually some hands-on treatment by a trained professional is going to be needed to get you 100% better, but hopefully this gets you on your way. If you have any questions, you can leave them in the comments below, or you can find us if you're in the Austin area and want to come see us here at carterpt.com.